Hello, my name is Jim Keller. I'm a professor of pharmacy medicine and oncology out of the University of Texas at Austin and the Health Science Center in San Antonio. Today we're going to talk about the impact on patients of CINV, or chemotherapy-induced nausea and vomiting. CINV negatively impacts the daily functioning and overall health of a cancer patient. CINV strongly correlates with the quality of life of a cancer patient. It can lead to dehydration, problems with nutrition, electrolyte imbalance, and can significantly impair the quality of life. The more nausea and vomiting a patient has, the worse they're going to feel. It can lead to a change in appetite. You can see extremes of malnutrition, weight loss, and anorexia. Patients also can be fatigued because of this, and they can actually have insomnia. You see a lower quality of life with the more emesis and nausea a patient has. So highly emetogenic chemotherapy would produce a lower quality of life than moderate emetogenic chemotherapy. And in fact, a lot of times nausea is a worse offender than the actual process of vomiting. Having protracted nausea, again, can be more problematic than intermittent vomiting. Poor management of CINV with what I've just mentioned, again, can certainly lead to a deterioration in quality of life even further. And these problems of dehydration and electrolyte imbalances can certainly lead to additional office visits, ER visits, and hospitalization. This next slide comes from some data by Martin, and as you can see that with the frequency, as the number of episodes of emesis increases, physical function, cognitive function, and social function decrease, which is what we'd expect to see. This next slide actually gets into, this is by Steve Grunberg out of the Vermont Cancer Center. This looks at perception of healthcare professionals and the reality of what patients go through. If you can look on this slide, on the left side, we look at highly emetogenic chemotherapy. And basically what this shows you is that healthcare professionals have a better prediction of what's going to happen to patients, especially in the delayed setting for nausea and vomiting, than what actually occurs. In this case, we can see patients over 60% of the time are still nauseated, and 50% of the time they're vomiting, and the healthcare professions feel that it's much less than that. If you look on the right side of this slide, you can see that for moderate emetogenic chemotherapy, again, the issue comes about in the delayed setting, both for nausea and vomiting, where the perception of the healthcare professional, we feel that the patient's doing much better than they are, and in fact, 52% of patients are still having delayed issues with nausea, and almost 30% of patients are still vomiting. So there's a gap in perception between what we think is going on and what's actually happening to the patient. This next study by Vidal is a European study. This is a much more modern study than the last study. This again shows a perception gap. It actually may be in reverse. And this basically says for the acute phase and the delayed phase that there's a difference in perception between nausea and vomiting in the patient. And in fact here, the patient may actually be having worse problems than the physicians and the nurses think. This next slide, again, is additional data from Vidal, and this just shows the difference in mild, moderate, and severe nausea on the top of the slide on the left, and mild, moderate, and severe vomiting on the bottom. And you can see again here there's a difference in perception of the degree of nausea and vomiting between healthcare professionals and the patient. And finally, I want to get into adherence. The adherence to guidelines. We know, again, we've just identified the problem. We identified that patients have different perceptions than healthcare professionals, and in fact, sometimes they're doing worse than we think they are. And the issue is if we follow the guidelines and provide antiemetic care appropriately, patients should do better. This is a study done by James Gilmore. You can see on the left part of this slide for highly emetogenic chemotherapy, or HEC, you can see when guidelines are followed that in fact patients do statistically better than when guidelines aren't followed. And the same thing holds true, although not statistically, numerically, in the moderate emetogenic chemotherapy treated patients. Patients also do better when guidelines are actually followed. In addition to that, Alex Chan out of Asia looked at, again, the association between adherence and giving the appropriate prophylaxis to patients. He again showed that from a complete control standpoint, that again there was patients did statistically better when they were adherent to the guidelines versus when they were not adherent to the guidelines. So following the rules and doing what the data supports, patients just do better. To summarize this section, uncontrolled nausea and vomiting is still a problem. We know that CINV can lead to dehydration, decreased performance status. Certainly it's directly correlated to a decrease in quality of life and can result in additional clinic visits, ER visits, and hospitalization. Prevention is the best course, and controlling this in the very first cycle is the best way to manage this. Historically, as I mentioned, healthcare professionals have overestimated the benefits of CINV management, and we've been working on that since. I want to thank you for joining me. Thank you.